Hello. Just like Glenda told Dorothy in The Wizard of Oz, there's no place like home. And we know this is true when addressing feeding behaviors in the NICU. In our 40-bed Level 4 NICU in Fargo, North Dakota, we found a way to promote more favorable family-centered feeding experiences and outcomes, encourage infant-driven feeding practices during their NICU stay and at home, earlier establishment of a more normalized feeding experience for baby and families, earlier discharge from the NICU, which resulted in reduced healthcare costs for the hospital and family out-of-pocket costs, and a reduced length of stay. We did this by initiating a discharge to home Gavage feeding supplementation program. What babies did we choose for the program? Well, they had to be at least 35 weeks gestation at the time of discharge. Caregivers must be willing to complete training and demonstrate proficiency. Babies must be feeding at least 40% by oral. They must live within 1 hour of the Fargo-Moorhead metro area. Must be followed by a Sanford Health primary physician while they are using the NG tube. They attend a feeding team clinic appointment no less than once per week while using the NG tube. The team usually allows the child to continue with NG tube supplementation up to 4 weeks before discussing a more permanent G tube placement. How did we develop this program? Well, necessity is a mother invention, right? So we knew we had more babies that needed our NICU than we had room for. Babies were hanging out in the NICU just to learn to feed, no other reason. Parents were experiencing NICU-itis. They wanted to get out of there. And we had a hospital-wide initiative to reduce length of stay. So we started planning. We established a multidisciplinary team to evaluate potential candidates, present options to parents, and follow up in clinic once home. Infants and families are referred by providers to the team prior to 35 weeks gestation. Nurses do the majority of the NG tube training with the caregivers, and our healthcare equipment company does the pump training. And post-discharge follow-up, pediatricians were more than happy, as you would imagine, to have another set of eyes on the baby and family, offer direction, recommendations for feedings, and to offer expert care if problems arose. So our results, well, since we had contacts with the family every single week, we knew that we were onto something. Parents were really happy. We had very positive feedback, and the babies were advancing to all oral feeds quickly and consistently. The results were we had 45 NICU babies enrolled. Mean age at time of discharge was 37 weeks. The average use of supplementation by NG tube was only 8.4 days once they got home. Total saving was 472 hospital days. 1 month of supplies of the pump rental and tubing was about $190. Daily hospital costs were $3,182 with a total savings of about $1.5 million for those babies. We have not seen our bonuses and our paychecks yet for the amount of money that we have saved the hospital, but I'm hopeful. So what did everybody think about it? Well, we had the caregivers, we had a telephone questionnaire. 24 of the 45 families we were able to get a hold of. 92% were really satisfied with the program, with the earlier discharge being the overall main reason of why they liked the program. 67% of the babies pulled out their tube at least once while they were home, and the caregivers were all able to replace the tube at home safely. 0% of the babies had to go to the ER, visit their doctor, or have any feeding difficulties related to the NG tube while they were using the tube. 100% of the caregivers said they were trained well and were comfortable with the use of NG tubes and the feeding pump. And 100% said they'd recommend the program to other NICU families.